Hi, my name is Roda and I'm the current GP registrar, and in this video I'm going to go through some of the tips that I wish I knew when I first started out as an FY1. I still vividly remember my first week as an F1 and I remember feeling really scared, really anxious, thinking am I going to be up to the job? Because going from medical school and being responsible on a ward, working as a doctor is a very big transition. So in this video I'm going to go through some of the tips that I wish I knew that really would have helped me make my transition into F1 life so much more easier. So here goes. So the first tip that is really important is that it's absolutely okay to feel out of your depth, to feel as though you don't know much. If you can imagine being an F1, you are right at the beginning of your clinical journey. So you are going to be the least experienced and the person with the least knowledge within the team. And the good thing is everyone around you knows this. So it's always really important to also come to terms with this yourself. Because I remember when I was first starting, I felt as though that had this pressure on me to be able to just get on with things right from the get-go. But like any new job, there's always going to be that period of feeling quite uncomfortable. And over time, you know, once you start getting used to how things run and the system, it becomes so much more easier. And the second tip is ask. And I cannot emphasize this enough. Please don't feel embarrassed that you have to ask for guidance or ask for clarification from your seniors. As a trainee, as an F1, you are here to learn. And the only way we're going to learn is through asking questions. Nobody around you expects you to know everything. And the seniors and the consultants that I've worked with really encouraged me to actually ask questions. You've been asked to review a liver function result and you don't really know what the significance of this is. Ask. You've been asked to review a patient, but you don't really know what the management plan is going to be. Ask. That's the only way we are going to progress in terms of our experience. A little pro tip is when you're on the ward rounds and, for example, the consultants ask you to request a chest x-ray for a patient that you've been reviewing, if you don't know why you're requesting this chest x-ray, ask. Honestly, the consultants really enjoy actually giving advice and information to juniors. And the other thing is you're going to come across as someone who's really keen and interested to learn. So it's like two birds with one stone. And the next tip is, which may seem really obvious, is to make an effort to get to know the people that work on your ward. That includes the nurses, the other allied health professionals, so the pharmacists, the OTs, the nurse practitioners. The experience I've had is F1s and junior doctors who actually put an effort in introducing themselves, making an effort to get to know the names of the people that work with them. It really goes a long way. There's going to be this professional barrier between yourselves and the other staff on the ward, but when you become friendly, get to know each other's names, you start seeing that people start doing favors for you. You know, as you can imagine, you've probably heard this, always be friendly to the nurses, and I cannot emphasize how true that statement is. And those nurses have been working on those wards for years and years. They know it inside out. They know where things are kept. They know how the patients are. They've been seeing the same patients for so many years, so they know a lot. It's always beneficial to make sure that you develop a really good working relationship with nurses, but also with the other staff members around you. And sometimes you may find that when you're on a really busy on call that you might be slipped a biscuit or a drink here and there. And the next tip is discussion etiquette. And this is something we don't really get taught in medical school, but ironically does actually form the bulk of our job responsibilities as an FY1. And that is discussing with other specialities. This is something that you're going to be asked pretty much on a daily basis. It's always worth knowing what is a good referral, be it over the phone or in writing. I'll give you a little anecdote to show you what happens when it goes wrong. And that was, I was asked to discuss a ultrasound report with a radiologist. And when he picked up the phone and he started asking me questions about what did the scan show, what is the patient like, a lot of information that unfortunately I did not have on hand. And a lot of my answers were, sorry, I don't know. So obviously it wasn't very happy. So a few little tips that go a really long way. So it's always really important to always have all the information on hand before you even pick up that phone. So who is a patient? What do they come in with? What is actually going on at the moment? What is it that you want this other specialty to be doing for you? Is it to come and see them? Is it to refer the patient to them? This takes practice, this takes skill, but preparation really does go a long way. The next tip is whatever presentation the patient comes in with, always start off with ABCDE. This has been drummed into us right from the first year of medical school. When you're on call and you're covering the wards out of hours, you will be asked to review patients who are deteriorating, who are very sick. It doesn't matter whether they're coming in with pneumonia or whether they've got infective endocarditis, the assessment is always going to be the same. And the reason I'm stressing this is as an F1, when you're asked to review a patient, sometimes it can feel really overwhelming overwhelming and think to yourself, what am I actually supposed to be doing? I don't know what's going on with this patient. But when you're able to fall back on a standardized assessment, it makes your life so much more easier. You're less likely to miss anything, and when you are presenting the patient to a senior, at least you've got that standard assessment to help you guide you through the presentation. And that brings me to my next tip, which is please download the Ask to See Patient FY1 handbook. This handbook was probably the most helpful tool that I had when it came to my on-call. So this handbook contains very common scenarios that F1s are expected to deal with. So blood in catheter bag, acutely agitated patient with a high early warning score. It's nicely summarized and it gives you what you're supposed to be doing kind of step by step. And I had this on my phone, downloaded it as a PDF, and it was really helpful. And the next tip is use the opportunities to practice your practical skills. So these are things like cannulation, taking blood. Unfortunately, at the beginning of our journey, we're not the best at taking bloods and doing cannulas because we tend to do them on kind of plastic arms when we were at medical school. At the beginning, I have to admit that I was really bad at doing either of those practical skills. But when you're going to be struggling, and that applies to any practical skill, have someone watch you. Instead of asking another senior to be like, oh, I can't do this cannula, can you come and do it? Have someone observe you. One, they're able to give you tips on your technique. Two, they're able to guide you so you're less likely to get it wrong. And in that way, because you're very hands-on, over time, it's going to be inevitable that you're going to get much better. And the next tip is please take breaks. This may seem really obvious, but I cannot emphasize how often people do actually neglect taking their breaks. You know, when you're on call, even in the day job, you can go 6, 7, 8 hours without having sat down once. And unfortunately, nobody's going to give us a medal for being able to work throughout the whole shift without sitting down, not eating, not going to the toilet. It's really important that yes, we are looking after patients, but we also have to look after ourselves. So making sure you're keeping yourself hydrated, having your food, going for toilet breaks, sometimes even just sitting down and having a breather really does go a long way. And I think self-care is something that we neglect as junior doctors, but it's probably the most important thing when it comes to avoiding things like burnout, job dissatisfaction, and emotional resilience and that type of thing. And last but not least is to enjoy the journey as much as possible. It's funny because I look back on my F1 experience with fondness. I don't know if that's rose-colored glasses I'm wearing there, but try and enjoy the journey as much as possible. It's a very steep learning curve. You're going to be learning a lot. You're going to be seeing a lot of things, but F1 is a stepping stone to greater things. So enjoy it as much as possible. So that's everything. Thank you very much for watching this video. Hopefully you found this helpful and it will make your F1 journey so much more easier. I personally run a YouTube channel called Dr Roda, so if you're interested in any sort of videos around medicine, productivity, self-development, then please do subscribe to my channel. Thank you very much for watching.